Good afternoon, good evening, everyone.
Buenas tardes a todos.
Housekeeping logistics.
Vamos a hacer una logística interna.
We do have ASL and Spanish language translation provided for this meeting.
Tenemos interpretación también para señas y lenguaje, como también interpretación en español para esta cita.
We'll go ahead and provide instructions to activate the Spanish language channel now.
Vamos a dar las instrucciones para que puedan tener acceso al lenguaje en español. Se ofrecen servicios de interpretación para la sesión de hoy. Para escuchar el programa en español, seleccione el icono o la etiqueta del globo en la parte inferior de su pantalla, que dice Interpretation. Luego seleccione su idioma, Spanish. De ahí podrá escuchar todo el programa en español. Gracias.
And we have Anna providing Spanish language translation. Who is our second Spanish language translator, if I may ask? It's not populating on the globe.
It's Yelka.
Thank you. All right, I will now turn it over to our Executive Director, Lori Benalis, to welcome everyone.
Great, thank you so much, Herman. Good evening, everyone, and welcome to our annual Purchase of Service Data meeting. My name is Lori Benalis, and I'm the Executive Director at Alta, California Regional Center. This year, we're going to return back to a previous practice and host 2 meetings. The first, of course, is tonight, where we will concentrate on going over the presentation materials. We have a team of our wonderful staff that will provide the presentation. And throughout the meeting, there will be opportunities to accept input through our chat. So we invite you to do that. We'd also like to remind you that we can also accept input with regards to the data, questions, etc., through a designated email address that is operational all year long. And that address is posequity@altaregional.org. We'll be accepting input at this email to have the feedback included in our report to the department for this year. We have a deadline for input in that lane to be received by April 4th. And so I just ask that if you are wanting for consideration of the feedback and inclusion in the report to the department, that feedback be received by April 4th. And again, the Purchase of Service Equity email address is available at any point of the year, and we are constantly monitoring that. Additionally, we're going to host a meeting following this meeting on Tuesday of next week. It will be Zoom with the registration as you just did. And it will be from 1 p.m. to 2 p.m. The intent of that meeting is to have a richer and fuller discussion of the materials that are going to be presented tonight, to answer questions and really to engage with our community in the topics that we're presenting. And again, to lean into accepting feedback and input from our community with regards to the data and how we can continually make improvements in access. So tonight, I'd like to introduce you to the team of our awesome staff that have spent the last couple of months going through the data that is posted on our website and putting together a presentation that we hope is meaningful to our community. First, Herman Kothi, who has already introduced himself and provided the housekeeping. He is our training manager, and he'll be part of the team tonight. Elijah Jenkins, who is our system operator and data analyst or scientist, and he has been so helpful these last couple of years in the position that he holds to help us look at this data and go through it differently. Michelle Johnson and Jennifer Bloom are our directors of client services. They're participating. In addition to Dana McCuller, who is our client services manager of our enhanced caseload. case management unit, and then an individual that is our cultural diversity specialist, Shamir Griffin, who reports to Dana in her unit, will also be participating. So with that, I'd like to hand it over to our team to get through the materials and hopefully provide information that will be meaningful to our community. Thank you.
All right, thank you for the introduction, and thank you, Lori, and the team for their help putting this together. My name is Elijah Jenkins. I'm the data scientist and senior system engineer for Alta California Regional Center, and I'll be doing some overview of the basic statistics and findings that led this this year's reporting and study. So let me get over here. So the first piece of data we're going to look at is this table. So the first column is ethnic subgroup as defined by the state of California. The second column is the percentage of each of those groups as represented in ACRC's entire client population. And the third column, the column with the header in orange on my screen, is the percentage of those same groups as represented in the regional center system statewide. So this is just a comparison of our ethnic subgroups as compared to the entire state of California for perspective. So this table builds on the previous table. Again, the first column is each ethnicity subgroup as defined by the state. The second column is the percentage of clients in that ethnic subgroup for Alta California Regional Center. And now we get into the spending by dollar amount. So the third column is the percentage of dollars spent per ethnic subgroup at Alta. The third is the spending difference, meaning the difference between the percentage of client population and the percentage of dollars spent. And similarly, the fourth column or fifth column, sorry, I'm having trouble counting. The fifth column is the difference of money spent at the state level, so amongst all regional centers. We shouldn't necessarily garner any initial findings from this. This is just a comparative side-by-side look at where we stand. But this is the first indication that such broad categories, while demonstrative of a statistical disparity, might not be the best measure of equity in service provision as in the way that the regional center system looks at it. The focus should be, in this case, on the red and green numbers of the statistical differences of plus or minus 2, but we'll dig deeper into those as we unpack all this analysis. So now again, an overview of the columns. The first column, the ethnic subgroup by state, and then the percentage of each group, the percentage of spending at the third column, the difference. But now we have a new measure, which is the percentage of authorized services. That's the percentage by count, meaning if we counted every purchase of service we wrote, the number of purchases of service by each ethnic subgroup as defined by the state of California. And then the last column is the difference in that percentage of count versus the percentage of clients. So right here we see that the percentage differences are sort of all over the place. And so that's what we aim in our study to sort of unpack. Is this division by ethnic subgroup the best way to determine whether or not we are aiming at equity? And I think that we have a really compelling model to show you. So the first thing we want to look at is a bar graph representation of these services, so we can get a quick overview that's easy to digest. This is a graphic representation of each statistical inference. So what do I mean by that? The blue bar, the first bar, is the percentage of people in a specific group. The orange bar is the percentage of dollars spent. And the green bar is the percentage of POSs written by count. So in a perfect world, if this were representative equity, this would all be flat. But as we can see, it's not flat. But luckily, we have at Alta Regional Center pretty robust data. So we're able to unpack the reasons why these bars aren't flat and why there seems to be an appearance of inequity, even though there may not be at the base level. So where do we start by unpacking this? Well, the first thing we need to understand is where we're spending that money and why. So this pie graph represents the top 5 categories of ACRC POS by budget spend. So what do I mean by that? 30% of the entire budget of Alta in terms of purchase of service goes towards SLS. The graphic is interesting because we know SLS is not the most utilized service, and we'll see that in the next slide, but it is the most costly service for our agency. So what is the most utilized service should be the next question, and why is that important? So the most utilized service at Alta Regional Center is actually in-home respite. That's followed next by transportation at 4%, community integration training at 3%, residential facilities for adults at 2%, and SLS at actually just below 2% if you account for rounding errors. So while the...
Excuse me, Elijah.
Yes.
Could you not use any of the acronyms and say what SLS is?
Oh, yes, my apologies. So SLS, supported living services. So supported living services means supporting a client in their own home or apartment with a staff in-house. So what we know is that even though 30% of our budget is spent in terms of purchase of service dollars on supported living services, that only represents 2% of all the purchases written. And that's a pretty big implication. That would start to lean us towards there's some choice in service that explains the reason for how much we spend in a given area. This is further exemplified by this graph where we start to break it out by percentage of purchases of service by count, and then we divide that by residence type, meaning where a client in ACRC lives. So as you can see, even though 30% of our budget goes to supported living, it is because supported living services, or SLS, is the most cost-intensive service. So even though just below 4% of all of our clients live in that modality, if you will, it represents a much larger chunk proportionally based on the choice of home or living framework. Whereas well over 75% of our clients live with a parent or relative or guardian, typically in a family home. So living at home with a family can be POS and cost intensive, but typically it is not. So in the next slide, we'll see the result of this. The result is per capita, meaning per client, on average, the cost of supporting someone in SLS or supported living services is roughly $198,000 per year. While if a client chooses to live with a family member or in the family home or with their guardian, typically the cost is roughly around $7,000. And we've broken this out by the cost on average for living with a parent, relative, or guardian, living in a community care facility or licensed care home, which is CCF 4 to 6 bed, living in independent living, which should be differentiated from supported living, and then living in supported living. And then in each of these categories, we've further broken that out into those earlier ethnic subgroups that we mentioned as defined by the state of California. And as we see, there are certain subgroups that for whatever reason are overrepresented in a more costly living modality than others. Although still most groups, regardless of how you slice them, tend to live with a relative, parent, or guardian. All right, I'll pass it to Jen.
Thanks, Elijah. This year, we decided to highlight some data on our self-determination program. Alta California Regional Center's self-determination program enrollment continues to grow month by month. We're really excited. It's not on the graph here, but on March 1st of this year, we have broken the 500 mark. We now have 501 participants in SDP at ACRC. SDP is Self-Determination Program. So as of December 2024, we ranked 4th for the highest number of SDP participants statewide. This graph here reflects that as of January 1st, we had 474 participants. And I just mentioned that as of March 1st, we have 501. SDP by county is the next graph that we can look at, the boxes on the bottom left side of the screen. And we have the most participants in our catchment area living in Sacramento County, and that's also where we have the most self-determination program participants. That's followed by Placer County, Nevada County, El Dorado County, and Yolo County. And those itty-bitty boxes represent our other counties, just trying to give a visual representation of how our SDP participants are spread across our 10-county catchment area. You'll also see that adults make up the most of our SDP participants, and those who identify as white make up the largest percentage of participants, followed by those who identify as Latin, then Asian, and Black. Thank you, Elijah.
I'll hand it to Herman, I believe.
Yeah, thank you, Elijah. So for the first time in over 10 years of holding these annual public POS data meetings, the law was changed to require regional centers to include in our report information on specific service types of camping, social recreation activities, educational services, and non-medical therapies. And why is this significant? Many of you may recall in 2009 when the state was experiencing a budget deficit requiring cuts in spending. Regional centers were impacted by another change in law at that time that suspended our authority to purchase social recreation activities, camping, and the like. Thankfully, in July of 2021, those services were restored, and social recreation services are now available to every regional center client. Alta certainly recognizes the importance of social recreational activities in the lives of all people, and people with developmental disabilities may face some barriers to accessing their preferred activities in their communities. And we want our clients to be able to fully and actively participate in all aspects of their life. So Alta made efforts to promote the availability of these restored services by including mention of it in every client's IPP. We also conducted trainings for staff, community, and vendors of the regional center. We held staff trainings in July of 2024 and August 9th and 27th of 2024. And we held public community trainings for clients, families, and vendors in August on the 7th and 23rd of 2024. Those training materials remain available on our website and are posted in multiple languages, including Arabic, Chinese, Dari, Hmong, Persian, Russian, Spanish, Tagalog, and Vietnamese. I'll drop a link to that training material on social recreation activities in just a moment. So what were the results of our outcomes and efforts? Over the last fiscal year, Alta spent over $1.5 million on over 2,000 clients, with an average of about $700 per client for those who were receiving services in these categories. Looking at the breakdown of spending by different groupings of ethnicities, We do see a fairly even rate of accessing these services across the different demographics. One outlier, however, would be the use of CAMP being used at a higher rate by the white population. What are some of the barriers we encounter to achieving even more equitable access and greater access for all? Staffing is continually identified as a challenge in our service system. The California Policy Center for Intellectual and Developmental Disabilities released a report on the impact of the direct support professional workforce shortage that stated, I quote, families found that respite, day program, social recreation and camp, behavior services, and supported living services were the top 5 hardest services to find. And we'll drop a link to that report in the chat as well, so you can review that. Next slide, please.
All right. We also did a statistical analysis of clients per DDS data that had no purchases of service or no POS dollars associated. So while this group was small, we wanted to make sure that we addressed this group and looked for any glaring inequities. This is a representation of the client ethnic subgroups as an agency and the same subgroups by percentage with no POS dollars. The similarity in the bar heights tell us that the proportions are very close, and once we do the math, we find that they fall within what's called the margin of error. As such, for this particular division and statistical analysis, there are no marked or concerning findings. Additionally, we did the same by dividing it by the top 5 languages as analyzed by DDS, so Chinese, English, Spanish, Vietnamese, and quote-unquote all other languages. Again, we found that the similarities between the proportions by our agency in terms of the number of clients and the number of clients in those groups with no POS fell within the margin of error. As such, there is no statistical concern of note in this area. I'll hand it to Dana.
So as a reminder to our community of the statute outlined by DDS regarding enhanced service coordination, the Budget Act for fiscal year 2021 to 22 provided funding for DDS to establish enhanced service coordination for individuals from diverse communities with low or no purchase of services. Now, this means that the cost of client services is under $2,000 within a 12-month period. A caseload consists of 1 service coordinator to 40 clients. And the hope is that with this reduced caseload, there will be improved service access and delivery for individuals from diverse communities who face barriers to regional center services. So just diving a little bit more into enhanced service coordination here at Alta, clients and 6 service coordinators within our unit ethnically or linguistically identify with Spanish, Punjabi, Hmong, Russian, or African American. We also have our wonderful cultural diversity specialist who will be presenting on our community-based organization partnerships a little bit later. But when you look at the data, review the data a little bit more closely, you will see that there are 178 clients represented in this data. The data that has been captured represents clients' preferred expressive language. Now, when you look closer, you'll see that on the pie graph, a little bit more than 50% of the clients do prefer English as their preferred expressive language. So some key considerations for further review are that clients have caregivers who speak the primary language identified within the unit. Just the ethnic subgroup and the client that belongs to that subgroup are not indicative of the language they speak. For example, we have Hmong clients that actually prefer to speak English, but their caregivers do speak Hmong. Some clients feel more comfortable with receiving support from an SC that ethnically represents their culture. And because of this, there is room for a client to come into the Enhanced Service Coordination Unit, not just based upon linguistic preference, but also ethnic preference. Some other key considerations that you should look at when you are looking at the bar graph is the other item, other languages. This consists of other Indo-Iranian language or other Asian languages. This encompasses not only the Japanese case that you do see, but also 2 dialects of Hindi, Urdu, Dari, Malayalam, Oriya, Nepali, and Telugu. These are some of the outlying cases that were grandfathered into our unit from the inception of Enhanced Service Coordination. However, we are addressing the needs of these cases prior to them moving back to the unit of origin. And eventually for our unit, eventually all clients do move back to their unit of origin. And as time passes, our practices do become more refined. Before I leave this slide, though, I do want to share some anecdotal evidence about some of the barriers to service access, as well as some of the successes. So some of the barriers are that clients have reported continuing to feel fearful of deportation if they access services. There is a lack of services in more rural areas. There are a lack of services that support a client's linguistic needs. There has been reported difficulty in finding providers who understand culture and speak the client's preferred language if the preferred language is not English. Vendors continue to be short-staffed. That's something that Herman brought up a little bit earlier. And due to previous service coordinator turnover from the units of origin, clients and families have communicated feeling a little bit more lost. So some of the successes in service access is that service coordinators have the ability to attend to increased training opportunities that help them to develop their skills in assessing clients' needs. These training opportunities can help service coordinators identify more generic resources for an entire family as deemed applicable. And because of this, service coordinators are acknowledging and understanding clients' cultural customs and standards. Clients and families have communicated feeling more seen and heard by their service coordinator. And service coordinators spend more time talking with clients because the caseload is smaller, and service coordinators are at minimum to see clients every 3 months.
Alta is dedicated to ensuring that the information contained in a client's IPP, individual program plan, is translated into the client and caregiver preferred language. It is our agency's best practice to automatically translate into the language of the client family, and as such, families do not need to request that we translate. Therefore, the DDS, the Department of Developmental Services, number reported for requested translations is 0. Between January 1st and June 30th, 2024, Alta translated 203 IPPs, individual program plans, into multiple languages. Spanish was the most commonly translated language. On average, the translation process took 42.6 days. As required by Welfare and Institutions Code, Alta must provide a written IPP in a threshold language within 45 days and in a non-threshold language within 60 days. ACRC submitted language access data as part of our participation in the Regional Center Performance Measure, which aims to ensure that regional center staff communicate with individuals in their preferred language.
Thank you, Michelle. This slide reviews
Esta
the...
diapositiva habla sobre...
Oh.
Oh. Huh.
I was hearing the translator, but I don't think they typically do. Are we okay? Okay. So, like the state of California, ACRC's clients, families, and employees are diverse. The pie chart on the left side of your screen includes languages spoken by all clients of Alta California Regional Center, with the English language included in that dark blue. 11.06% of the ACRC client population speaks a language other than English. Looking at the chart on the right side of your screen, you'll see languages spoken with the English language removed. We group the data the same way that the state of California does for simplicity. Here, you'll see that 60.85% of our clients speak Spanish, 4.36% speak Vietnamese, 2.15% speak Chinese, and 32.63% are categorized as other language. As Dana mentioned a few slides ago, there's support across the state to represent languages more accurately. For example, other language encompasses a wide array of languages and doesn't tell us about the languages spoken specifically by those we serve, nor does it inform us about how we serve them. There's work to be done in this area in language access and equity. We're happy to share that our newly launched case management system captures languages at a more granular level so we can differentiate between preferred expressive language or receptive language. Next slide, please. So we recognize the critical importance of bridging gaps in service areas across our agency. This means that we want to ensure that our employees offer a wide array of languages spoken and that we have employees who understand the cultural diversity of our clients served. Taking this further to our direct service provider community, we know that clients and families need and want providers who understand their culture and speak their language. And without this, we have seen underutilization in some authorized services, in some authorized purchase of service. The pie chart on the left side of your screen represents all of the languages spoken by Alta's bilingual employees. We are proud to report that our employees speak 16 languages, with Spanish being the second language of 58% of our bilingual employees. The pie chart on the right side of your screen shows the bilingual employee languages grouped in the way that the DDS classifies languages spoken. Next slide, please. A little bit more about our staff's language. We're really proud to share that we have 179 employees who are fluent in a second language. In fact, 22.49% of our employees are bilingual to meet the needs of 11.51% of our clients who are also bilingual. The pie chart on the left side of your screen represents clients who speak a language other than English, and on the right side, you will see the percentage of ACR employees who are fluent in a second language. Again, categorized broadly for simplicity and consistent with statewide data. Next slide. Okay, Shamir.
Thank you, Jen. Good afternoon, everyone. I hope you're having a wonderful evening. I'm Shamir. I'm the Cultural Diversity Specialist. Over the last year, Alta California Regional Center has been able to engage with 137 community-based organizations to provide outreach at 127 different outreach events this year. At these events, we are able to meet clients where they're at and be able to better interact with both clients, caregivers, and community partners. These are just some photos and some names of some of the events that we attended last year. Compared to the year prior, we attended 127 versus 101. If you could please turn your eyes to the photo on the right middle column, There's actually a story of some of our staff during Chinese New Year of 2024 at Luther Burbank in South Sacramento. So during this time, I was at the Lovely Irish event myself. Service coordinators Emily Chang and Yi Li came to provide interpretation and translation for the Chinese New Year festival. They had mentioned that there were some reservations due to Chinese New Year being seen as an auspicious day in which people do not talk about mental health, death, intellectual or developmental disabilities, and in general within the Chinese community which they belong to, it is not mentioned. During the event, Yi Li, pictured in the photo to the right, wearing the lovely gray suit, was actually able to not only interpret and educate and provide translated material to clients and to people within the community. She was able to actually connect with one of her clients and families who was thankful not only for the services she provided personally, but for us being there and being visible. This shows the importance of outreach and being in the community and providing language in our client's mother tongue. Thank you, and may you please go on to the next slide.
So here we're going to cover some of the initiatives that ACRC either has in place or in process to better address the equity of service provision and service provision as a whole. So firstly, ACRC has deployed a new client service management system. And this year we plan on launching the Client and Family Portal. The Client and Family Portal will be a internet or web-based portal in which clients and families will be able to log in, connect their portal account to their client record, and be able to see things like the most recent IPP, purchases that are in process, in place, or are pending for various reasons. They'll be able to get the contact number of their service coordinator, find out what unit they're in, update email addresses, phone numbers, as well as see any pending applications for intake. Additionally, ACRC is engaging in the exploration of auto translation features through a variety of technological focuses. What auto translation would allow is a family to choose to receive their documentation automatically and virtually instantly in their preferred language through an AI translation. This does not negate the necessity of human translators, and human translators will continue to be available regardless of the implementation of this feature for families who prefer to have their document translated by a human translator. Last year, we rolled out the iPad real-time translation in Office. This is an iPad program that allows us to use Google Translate to communicate with non-English speaking families and clients who drop in for a meeting in our front offices, who have questions. And if someone who does not speak their preferred language is available, a service coordinator can utilize one of these iPads to have a basic conversation, give them critical information, and point them in the right direction until such time as we can locate a translator. Additionally, ACRC has been engaging with and examining the data from a family satisfaction survey that both measures the satisfaction with the availability of services, the outcome of an IPP, and basic case management. And lastly, ACRC does an ongoing analysis of needs and trends. So that means needs as in ongoing needs for specific groups, ongoing needs for specific services and frameworks, such as, for instance, an increase in a need for a day program in a specific area, or an increase for a need in a translation for a specific language. With our new case management system, we have a very robust base system of data that we're able to pull from real time and quickly identify issues, trends, needs, and address them accordingly. I'll hand over the middle section to Shamir and Dana.
Thank you, Elijah. All right, everyone. So we at ACRC understand that other barriers that our clients face can also be considered technological device. One of the ways that we address that is that we have our Chromebook lending library. Currently, we have 33 Chromebooks in which we loan them out to our current clients. The Chromebooks can be adjusted so that they can be read and used in clients' language of choice. In addition to that, we also give out information for other complimentary and free resources so that clients are able to get internet access or apply for things such as iPads through LARC, etc. Discussing the importance of language access and cultural competency, we have continued to strive forward in order to make sure that our services are representative of those that we serve. This year alone, we have worked alongside of La Familia Counseling Center, Hmong Youth and Parents United, Visión en Compromiso, as well as UC Davis and CSU Sacramento to have listening sessions, feedback groups, as well as to have events and create tech navigation programs that allow for people who live in low-income communities and areas to receive help and information in their target language from people at these agencies and to learn more about local generic resources that we cannot provide directly at ACRC. There's also been the development of a toolkit with UC Davis. We're currently working on and developing a Russian and Spanish platform for early start with Happy Ladder so that our families that are living in more rural areas are able to get access to information and help planning that is based in ABA and B principles to assist them in that regard, as well as our classes with Visión en Compromiso, which target our BIPOC populations and are being offered all throughout our more rural areas within Yolo County. Currently, there are 3 classes ongoing, and they're being offered in English and Spanish. In addition to that, we have continued to broaden our outreach attempts and continue to work with more and more diverse community partners. I have now, my apologies. I've now submitted in chat a link to the wide array of community partners that we work with within Alta California Regional Center that provide free and generic resources across the 10 county catchments that we work that provide a myriad of services and languages that we don't necessarily target, as well as a list to our clients. One of the more important things that we want to focus on is the client themselves, and by highlighting the intersectionality of their culture, their gender, their expression, how they see themselves, as well as their ID, because no one person is solely what they're labeled as. And part of that is while using our lock funds, we've been going and offering a $100 stipend gift card to our caregivers and clients who are willing to share their stories. And these stories are written, they're publicly available and linked below in the chat so that they can tell their story and express what about their culture, what about the holiday, what about their religion that they celebrate and is important to them. And it makes it more personable. And it's a very important part about changing the dialogue and how we see IDs, DD, as well as culture and how they intersect. I will now pass it over to my manager, Dana.
Thank you, Shamir. So initiative-wise, with Enhanced Service Coordination Unit, again, we are continuing to refine our processes, but we've built partnerships with our diversity outreach work group, collaborative, and participating in outreach events that are occurring across our catchment. We are educating our clients and families on regional center services, and we are increasing and establishing individualized self-empowerment efforts for our clients. And I will pass it to Herman.
Thank you, Dana. I'm going to drop in the chat as well another resource to help bridge the tech divide. It was a Service Access and Equity Grant awarded to one of our collaborative partners, El Arc Congreso Familiar, that offers iPad and training on technology to Spanish-speaking families. They still have availability, and we do have 7 Alta California Regional Center clients taking advantage of this resource. Other initiatives we host, we know the importance of getting out and seeing clients where they're at. That's why the participation in those community events was so high this year. But we also do like to host our own event and invite clients and families to come see us. Our annual event that we hold, where we see the greatest amount of clients and families come to visit us, is our annual Santa Day event that was held on December 13th of 2024. The primary purpose of Santa Day is to create a fun experience for our clients and families to join us in a safe and comfortable environment where everyone feels welcomed and appreciated. We also celebrate a variety of different cultures and holiday traditions, hosting tables with activities and treats and snacks and photos with Santa. We were featured on KCRA, and there's a YouTube link that I can drop in the chat if you'd like to check out what Santa Day looks like. Sending that. Additionally, we spend a lot of time training staff. We know that the relationship between the service coordinator and the client and the family is the most important thing that the regional center offers, and that trust needs to exist, and our staff need to be well trained. So we offer cultural and competence training to all of our service coordinators, frontline managers, intake, and clinical team members. We elected to do that by contracting with a training outfit known as Circle Up, and provide 2-hour trainings quarterly for a full total of 8 hours. 267 of, at the time, only 522 staff required to take the training had completed the full 8 hours. Because it's on a revolving cycle, we'll always be continuing to capture more. Additionally, the Lanterman Act required that all regional center employees receive implicit bias training, and the State Department of Developmental Services contracted with a training organization called Equitify to deliver the same training to all 21 regional centers throughout the state. And to this date, 619 of Alta staff have completed that training. And I think that concludes this slide.
All right, thank you, folks. That concludes our presentation. Again, our presenters were our Executive Director, Lori Benalis, Jennifer Bloom, Director of Client Services, Shamir Griffin, Cultural Diversity Specialist, myself, Elijah Jenkins, Senior Data Scientist and Systems Engineer, Michelle Johnson, Director of Client Services, Herman Kothi, Training Manager, and Dana Muckiller, Client Services Manager for the Enhanced Service Coordination Unit. Thank you.
Okay, thank you to the team for presenting this data and packaging it up in the way that you did, little bites and pieces for the community to take a peek at. We'd like to invite the community to continue to look at the presentation. As mentioned, it is posted and available across multiple languages on our website. So we really invite you to go to the website. And I wonder if someone might navigate to the website to show where it's posted. And then continue to think about the data. I would like to then invite you back next Tuesday at 1 o'clock. Same registration, Zoom. and an opportunity to have a discussion on the data and to further develop any ideas and input that would help further develop the initiatives that we work on, some of which that we mentioned tonight, so that we can include those in consideration for planned activities over this next year, so that when we come to you next year, we'll be able to share on some of the output that data hopefully will be trending in the directions that we're intending for it to go, and increasing service access and equity. Again, the state is taking a lot of consideration in making sure that they're operationally defining what equity is in the service system. And so I really look forward to our next year's meeting when that operational definition is codified and accepted across the state, especially within our system, so that it will create another level to the conversation that we're having, and further develop the opportunities for us to get closer to the objectives that we all seek to find. And that is that everybody that is seeking the services that they need in our system will be able to receive those services. And so with that, I would like to thank you all for your time tonight, and we're going to give you back an hour and invite you back next Tuesday. And thank you so much.
Thank you.